There was a lot of talk about health disparities at the JP Morgan conference, and Jefferson was one of those systems that talked pretty strongly on the topic. And I think the quote I picked up was, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And I guess the question around this is how can technology play a role in addressing health disparities in a community like Philadelphia?
Look, I think there is an opportunity for technology to play a significant role. So at the same time, I worry about digital divide as well, right? I'll give you one example. That the need for access to broadband services became glaringly obvious during COVID, right? We saw exponential increase in the use of telehealth services, and it's something to be celebrated. And health systems across the nation, saw an increase, and it's just amazing thing to happen. But in order to have a successful telehealth visit, you need at least a mobile phone or desktop, right, and a working broadband connection. And not everyone have a robust broadband connection. Not everyone have a working device at home. It's very difficult to e-check in if your computer is broken, have virus, or is just slow processing wise. If you don't have proper broadband connection and you're relying on some connection that often fails, 20% of our telehealth as a point of reference fail because of some issue at the endpoint. Okay, so to me, it highlighted the need of robust broadband connection, which generally speaking, you don't think as related to healthcare. It's just, hey, internet connection. But it is, yeah, and has become a very key way, and especially when we think about hospital at home and sick care at home and Jefferson without address, this is just significantly important. Without a robust connection and without access to digital tools, there will continue to be a divide. And frankly, I think that there is a part of where I think that government can play a role in regulating broadband connection. And in my mind, frankly, we have to start treating broadband as a utility. Power, water is no longer a luxury. And similarly, to access to digital devices for underserved population. With these things, I think we can really cut through the big issues of access and affordability with the help of digital, right? We really have an opportunity to reach a population which otherwise don't have access to facilities, healthcare facilities, right? And we can help them in their homes, wherever they are, and in a very affordable way. I mean, telehealth makes everything very affordable. Now, on the other side of things, like, look, I mean, there is a lot of promise for technologies like AI and machine learning. I was discussing with our chair of radiology the ability for AI to read through X-rays in perhaps underprivileged communities in some developing countries, the ability for AI to flag things like X-rays or CTs and help in an area where there are just not specialists, there are not radiologists available, right? So I think that there's enormous potential, and technology can certainly play a role in addressing health disparities in a community like Philadelphia and beyond. But there are some very important and difficult questions that we need to answer in terms of access and affordability around digital technologies, broadband access, and affordability.